The Ministry of Health says 10,728 mosquito larvae grounds have been identified during the National Dengue Prevention Week.
The Health Ministry has issued a warning that there is a rise in the number of dengue patients reported around the country.
A total of 463,827 premises have been inspected.
I'm Neelika Malavige. I'm a professor at the University of Sri Lanka. Today I will talk about dengue infections, which has been causing devastation in Sri Lanka and the rest of the world for quite a long time. Dengue has caused devastation for over 7 decades in Asia and many other countries. In Sri Lanka since late 1980s, and the number of cases have been increasing every year and spreading in many geographical locations. And there are many reasons for this increasing in number of cases, including increasing global temperatures, which increase the spread of dengue even into warmer, colder climates. And also, particularly in Sri Lanka and other countries which are tropical, the rise in environmental temperatures increase the frequency of mosquito bites and also shortens the duration where the adults mature. So the adults are there to spread dengue for a longer time in their life cycle. This contributes to increased dengue transmission and subsequently leading to increased number of dengue cases. Now, how do you know if you have dengue? So dengue begins by a febrile illness. You have fever, body aches, headaches, you find it difficult to eat, you might have joint pain and so on. So if the fever doesn't go away in about 2 or 3 days, you should go and see a doctor. A doctor typically does a test called the full blood count and sometimes a dengue specific test called the dengue NS1 antigen test. Now the dengue NS1 antigen test, if it is positive, it confirms that you have dengue, but unfortunately sometimes it can be negative and you can still have dengue. So just because your dengue NS1 antigen test is negative, that does not necessarily mean that you do not have dengue. Now the full blood count is very important, especially you should get one if you have fever for 3 days and you should see a doctor on the day 3 of fever. Now a lot of people, what they look at is the platelet count. Now I should talk about the platelet count because there's a lot of worry about platelet counts going down. So the lowering of the platelet count is a result of dengue and not the cause of severe dengue. So it is an indicator. So we use platelet counts to find out, along with other clinical parameters, to find out whether we should admit a patient to hospital. And once the patient is in hospital, we monitor platelet counts to see whether the patient is, which way the patient is progressing. But the features of severe dengue or dengue hemorrhagic fever is plasma leakage. So there is fluid or plasma leakage out of capillaries, which accumulates in your pleural cavity, which is the lining between the lung and the chest. It accumulates in your peritoneal cavity, which is within the abdomen. And when there's a lot of fluid leakage, that can lead to shock. So the platelet count does not actually cause all this leakage. It is the leakage that we have to worry about, and this is why in hospital people undergo ultrasound scans and other tests to find out if they are leaking. So and your urine output and so on are measured. So unfortunately there is no specific treatment for dengue, and currently what is measured is how much are you leaking, if so how much are you leaking, and then fluid is given accordingly. Now, who is likely to get severe dengue? So a lot of people who are infected with the dengue virus show no symptoms at all. So you might have had 1 or 2 dengue infections unknowingly. But the people who are most susceptible to develop severe dengue are individuals who are pregnant, individuals who have other illnesses or diseases like diabetes, obese individuals, especially individuals with obese fat around their stomachs, people with high blood pressure, cardiovascular disease, kidney disease and so on, and also very old people. So these are the type of people who are more likely to develop severe dengue. And if, for instance, if a pregnant woman develops fever, you should actually go and see the doctor on the first day of it itself and get these tests done rather than waiting for 3 days. So when I said people should go and see a doctor within 3 days, that is not after 3 days, but on the day 3 of illness. By proper monitoring and detecting dengue early, we can save lives and also complications that happen in dengue. So although there is no treatment for dengue right now, if you go and see a doctor on time within 3 days since onset of fever, you can actually detect these complications and prevent the development of complications and see the disease and save lives and complications. Thank you.